Welcome back. Right now, you're speaking with Lori Weston. She's the administrator at Intermountain Park City Hospital. Grateful that she's joining us today to give us an update. It's hard to believe we're almost a year into this pandemic. Lori, how are things at the hospital right now?
Good morning. Thanks for having me. Things here are good. We've established protocols here at the hospital. The team is doing very well. Our volumes are manageable right now. Doing a lot of our normal preventative services, surgery, and those types of things, and just managing through the pandemic and doing a great job. We've got testing going, now starting vaccinations partnered with the county. So things are going really well.
Looking back at this past year, what are some successes that stand out to you as administrator of the Park City Hospital?
Successes, I would say really community and teamwork. Our small community here at the hospital, the things that we've done here to get on top of the pandemic and care for patients, keep them healthy and well. And then also outside of the walls of the hospital in our community. It's just been really wonderful to see all of the community coming together, with the health department and health systems to take care of everyone that lives here, keep them safe. The community does a great job with following the things that we've put in place for social distancing and masking. And so it's really been a huge success to watch that. Park City has really led that effort in Utah on the right way to do things.
And also, as you look back at this past year throughout the pandemic, anything that you've learned as administrator of the Park City Hospital, anything that you're going to take with you as we continue into 2021 and hopefully get to a point where we don't have this pandemic?
Right. I think the biggest thing that we've learned is nothing's constant with COVID. I think that we know that things change rapidly, and we are continually learning. We're continually changing protocols, the way we treat patients, things we do to keep people safe, our treatments. And so knowing that every day walking into the hospital, even in things we're doing in the community, it's going to change. And there's not a new norm established yet. We're still in a race to fight the pandemic, get vaccinations out. We've got new variants that are introduced. And so it's a continual process for us to adapt to what's going on around us each day.
Park City Hospital has worked very closely with the community, specifically with Summit County Health Department throughout this entire pandemic. Tell me more about that relationship and why it's so important.
The corona pandemic it's a public health crisis. And the governor of our state has mandated that the local health departments own this process. And here in our community, we've decided to really try to come together. Intermountain is really here to help the health department do what we can to get the vaccine out to people. This really isn't a time for us to say, this is your job, or compete against who can get ahead of this faster. It really is going to take all of us to come together to do that. The health department and Park City Hospital recognize that very quickly. And the goal is really to get as many people vaccinated as we can. And so in order to do that, we offered our services, and then we're working with other partners in the community to make sure that we can get the vaccines out as quickly as possible.
And I'm curious about that. How is the distribution of vaccines going?
It's going well. I think our biggest struggle is just supply, right? So every week we find out how many we're going to get. We've got clinics set up, and so as soon as we get those in, we're getting those distributed. And Summit County is not alone in that. I mean, the state gets a certain amount, and then those are distributed to all of the other health departments throughout the state. And so it's really a supply issue. Once we have them here in Summit County, we are giving them out. Summit County is, of course, giving out the first doses at the movie studio, and the hospital is giving the second doses out through the month of February. And so that partnership has worked well, and we're trying to get as many people vaccinated as we can, as long as we've got the supply to do it.
And how concerned are you and hospital staff about these new variants that are coming out of COVID-19?
You know, it's one of those things that are still being looked at. We the precautions are the same. You know, it's not that the variant are introducing new things that we need to do differently. We still have to mask, we still have to social distance. There's not a lot known about the variants. We know that our vaccinations are good and protect us with some of the variants and not as good with another. We know that the UK variant is more prevalent here in the United States. I think we've had 3 cases in Utah. And so it's something that we're monitoring. It does get picked up in our testing that we do. So you at least test to say you have the coronavirus. I think 1 in 50 of those tests are ran to see if it is a variant, but the vaccines are still effective. Our social distancing, masking, and infection prevention are still very, very important right now. That's what's going to keep us safe.
We're almost 2 months into 2021. As you look forward to this year, what are some goals that you have? What are some things that you're actually looking forward to as we continue into 2021 more?
Yeah, I think it was a huge relief to have the vaccine become available here in our community. It was a sign of hope for us here at the hospital to know that you know, we're taking that next step into prevention versus just reactive of testing and you know, trying not to get the virus. And so as we look forward, it's really about getting that vaccine out and keeping our community safe as we have done, but also helping the community heal. The pandemic has really taken a toll emotionally and physically for those that have come down with the acute coronavirus. And so our job here at the hospital and partnered with our community is to help the community heal and move forward, get people back to work, and help them with their if there's mental health services that they need, and get them that support. It's been hard on families. It's impacted our children in schools. And so how do we help the community heal and start to move forward and find out what that new norm is going to be, which won't be for some time.
And Lori, as a member of the community, I very much appreciate this united front that the hospital, the health department, officials for the city, for the county have presented in giving us the same information. It hasn't been a confusing time, although it's been so tough. We definitely appreciate everything that you have done and your entire staff has done to help support the community throughout this pandemic. And we're thankful for the time that you've spent with us today to update us on the hospital, the numbers, vaccines, testing, all of those things. So once again, thanks to Lori Weston, Administrator of Intermountain Park City Hospital. We'll be back with more right after this.